Okay, so who here by show of hands knows someone or has personally struggled with depression? Okay, so it's sad that depression has taken over our modern world. In June of this year, the Mental Health in America Association did a study that stated 1 in 5 Americans struggle with some form of mental disorder. And in a study done earlier this year by the ADA, or the Anxiety and Depression Association of America, it was stated that 7.8% of American adults struggle with some form of depression, whether that be minor or major. So today I'm going to be talking about the definition and symptoms of depression, depression versus sadness, and then awareness and prevention of depression. So, Dr. Brent Salveson, who got his PhD in mental health studies at Stanford, stated in a case study that he published in September of 2015 that depression is a condition of mental disturbance with severe despondency accompanied by feelings of hopelessness and inadequacy. Obviously, that's a really complex definition, but in simpler terms, it's a mental disorder that affects every aspect of one's life, their emotions, their spirits, etc. So the symptoms of depression there's a lot, but there's like self-hatred, constant need for reassurance, oversensitivity, loss of energy, self-harm, weight fluctuation, and then in severe cases it can cause like suicidal thoughts or even hallucinations. So sadness is defined as the feeling of sorrow and unhappiness. Short-term depression and sadness can seem really similar, but they're not the same. During prolonged periods of sadness, like after the loss of a loved one or after a breakup, it can feel really similar to depression, but it's not quite the same. Depression is a life-consuming mental disorder, and it causes a sense of being down for weeks or months at a time. Sadness may feel the same way for a day or two, or maybe even a week, but long-term it'll go away. It's also been shown that depression is different from sadness because it's rooted in the brain. In October of 2016, Dr. Diego Pizzigalli did an extensive study of depressed brains versus normal brains, or people without mental disorders. He got his PhD from Harvard, and he's the director of the Center for Depression, Anxiety, and Stress Research at McLean Hospital, which is the Harvard affiliate hospital. And he also is a psychiatry professor at Harvard as well. His research stated that the amygdala is a structure that is associated with anger, sorrow, fear, and pleasure, and he found that the activity in a clinically depressed person's amygdala was higher than a normal person, and that it was higher before they started showing symptoms of depression. So prevention for depression for yourself is fairly easy. There's a couple ways to ensure that you not necessarily don't get it, but that you're keeping yourself as happy as possible. Getting enough sleep, exercising regularly, eating right, and then finding something you're really good at. Doing these as a college student, I know it can be difficult sometimes, but setting aside, 6 to 8 hours just to sleep isn't as hard as you would think. Going to the rec center to walk for 30 minutes a day isn't as hard as you would think. Eating right and doing stuff like that isn't that hard as long as you're in the right mindset that you need to be doing those things to ensure your mental health. And finding a passion is also so important. Finding something that you feel like you're really good at, whether it be a musical instrument or drawing or something like that, something that you can take pride in, is really, really important. So self-prevention is important, but so is peer prevention. Making sure that if you feel like one of your peers or someone you know is showing symptoms or signs of depression, that they know that you're there for them if they need it, that there's professional help available to them. Just be open to helping them. So another really important part of prevention is awareness. World Suicide Prevention Day is September 10th. Self-Injury Awareness Day is March 1st. And Depression Awareness Month is October. So all of these things are important to raising awareness for depression and raising awareness for people who might be struggling with it and don't know how to ask for help. So today we discussed the definition and symptoms of depression, the difference between sadness and depression, and the importance of awareness and prevention. And for me, and for I'm sure a lot of people in here, this is kind of a topic that hits really close to home. But like I said, raising awareness and promoting prevention is really important to helping stop depression, I guess, for lack of better words. And I felt this was a great platform to do so. Thank you.
Awesome, great job.